Welcome to one of my very important video about how to engage your core muscles safely and effectively and lumbar stabilization if you have back pain. Hi, my name is Annie and welcome to my channel, Annie Pilates Physical Therapist. In this video, I'll be talking about neutral spine, core engagement, proper breath work, and how to use resistance safely and effectively if you're having back pain without exacerbating back pain. So get your mat ready, elastic band to join me today. Okay, my friends, this is another part of my free training, so you learn more about my back masterclass program and how to apply the core and back immersion therapy. So with my patients, I usually start proper breath work on how to really engage your core and keeping the neutral spine. To learn more about that, I have a video about how to do printing technique as well as what's the neutral spine position. There's 2 videos already for absolute beginners on how to do proper tilting, finding the sweet spot of your spine. And in this video is the 3rd progression. And this time with the elastic band, usually I place the elastic band around your thighs as a gentle closed kinematic chain to slowly engage your abdominal core muscles, keeping that lumbar stabilization at the same time with an extra challenge and push. Once my patients know how to do deep breathing, core engagement without any increasing back pain. And once you learn those 2 videos, then you can apply this program. So before we added more open kinematic like dumbbells and ankle weights, usually this is the safest with the elastic band. And of course, lying on your back is one of the safest way because when you're lying on your back, your lumbar spine all the way to your neck, the thoracic cervical are much more stable. But of course, there's different varieties of back pain. If you're having more pain lying on your back, there's also the McKenzie program you can apply that you can learn with my program. So one of my favorite exercises with elastic band and lying on your back is butterfly. So when you do butterfly, you're slowly engaging your external rotator of your hips. At the same time, those deep hip joint muscles that interact and connect with our pelvic floor, all at the same time with deep breathing. And I want to hold that for 10 seconds. Hold, and then slowly go back to the center. So as you breathe in, squeezing your core in, abdominal bracing, and sometimes keeping that neutral spine, placing your hand at the small of the back as you open your knees out and then breathe out. With that breathe in and breathe out, with that hold is around 10 seconds and then go back to the center. And usually we do that 10 repetitions for beginners, then slowly progress to 2 sets. And then when you have no pain and you can continue up to 3 sets, as long as after the program you're not having more pain. And after doing that beautiful butterfly, that's when I challenge with the gentle tabletop. Tabletop is the best way to strengthen your hip flexor. As you breathe in and that 90-degree bend, and then keeping that knee level to your hip, and then exhale down. And usually I alternate left and right as a mirroring effect. If one side is weaker, the good side will be the role model for the weaker side. So as you inhale, exhale, you might find one side harder or stiffer, and that's okay. And that will help slowly engage your core, your hip flexors, especially if you're having back spasm, all at the same time, keeping that neutral position by placing one hand at the small of the back so you're not straining your lumbar spine, keeping that mind-body awareness as you breathe in and breathe out. So after that beautiful tabletop, the 3rd exercise is tabletop with hip abduction. So as you open your knee out, you want to keep your pelvis leveled. So if you place a cup of coffee, most of my patients with back pain, as they can do the tabletop, but once they start opening, they're lifting the hip up because of stiffness on their hip joint, as well as weakness on their lumbar spine and core muscles. So I'd rather have the knee out, not too much opening. I'd rather have it slightly open, engaging that muscle. The most important thing is keeping everything stable here. If you place a cup of coffee, as you open, you don't want to spill it to the side. So that's the best way to remind yourself. It's not about the more range. It's about keeping your lumbar spine stable. All at the same time, one breath, one motion. As you breathe in, breathe out as you open, back center, and down. And usually I alternate left and right. And my goal is up to 10 reps for beginners and slowly build it up to 2 sets. all the way to third set as long as there's no increasing pain. If the elastic band is too challenging, as I said, you can go back to my previous videos and you can do this without any resistance band for absolute beginners if they're very weak and tight and if there's any increasing pain. I don't believe in no pain, no gain. I believe in doing movement without pain because if there's more pain, it will weaken you. Pain will introduce weakness because the pain will go to your brain cells and will confuse the muscle connection again to your body. So what's the point of exercising if you're having more pain? And the last exercise that I test my patients and to slowly improve is the sciatic nerve glide. Place your hand at the back of your thigh, slowly extend your knee, and most of my patients can't fully extend because of back pain, stiffness, and tightness, as well as guarding. So the sciatic nerve is getting irritated a little bit, so you want to make sure you just floss it gently. You don't want to overstretch that nerve. So as you extend, you can stop at this level and then dorsiflex for a gentle pull on that nerve and floss it. And then extend and then slowly bend in dorsiflex position. Tippy toes as you extend and then dorsiflex. Once you reach that level and down, you want to make sure you feel a gentle stretch and a feel-good stretch, not excruciating pain. And my recommendation is usually 10 repetitions only and not more than that, because with sciatic nerve, you don't want to overfloss. It's like you want to slowly tug that area and slowly build the flexibility and mobility of your hips, hamstrings, and the nerve. You don't want to pull the disc. You want to slowly warm up the tissue for soft tissue healing. I'm hoping you learn a lot about how to start engaging your core, slowly build up strength, keeping that neutral spine, and proper breath work. If you learn a lot about this and want to continue on with the program, I have my back masterclass. I'm reopening on April 30 of the end of this month for those who will need an extra support and guidance from me to learn more about the sweet spot of your spine and what is your proper posture technique to slowly live and regain life without back pain, to improve your core strength and improve your overall posture. If you have any questions, suggestions, or concerns about this video and how to regain life without back pain, click the link down below. Be part of my early bird waitlist for a first come first serve basis about core and back immersion therapy, which is the beautiful therapy method that I've been applying to thousands of my patients who recovered from back pain for good. Click the link down below. Be part of my early bird waitlist because I work well with a handful of students so I could guide them safely and effectively if they're suffering from back pain, weak abdominal muscles with weak core, postpartum, and other situations where the core is so weak and no matter how much you do massages, acupuncture, and chiropractic treatment, if you don't fix the root of the problem, which is a weak core, poor posture, then the back pain will come back again. So click the link down below. And want to learn more about Pilates, yoga, physical therapy, health, and wellness, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you give to my channel, you are supporting me. I'll be releasing the third free training that you can also start. So you will also receive that as well once you sign up on my early bird waitlist. So you can already jumpstart on healing your spine, improving your core strength, flexibility, and mobility. Click the link down below so you can receive those free services already as you slowly progress on reaching your goals of a stronger core, improved posture, and overall health. I'll see you next time on my third video. Always remember, be safe, be well, and healthy. See you in my next video training. Bye!